Experience holiday cheer at Tanger Outlets with savings up to 70% off your favorite brands. From fragrances to accessories and the latest styles, discover the best gifts for everyone on your list. Save big at Nike Factory Store, Michael Kors, Under Armour, Coach, Polo Ralph Lauren, Kate Spade New York, and so many more. Unwrap the best at Tanger Outlets. Hundreds of brands, endless gifting options. Plan your trip at Tanger.com.
Let's get into What's Up, Doc. Every week we spend some time with our friends, the experts in healthcare at Mercy Health, and this morning is no exception. This morning we're going to talk about interventional radiology, and we're going to spend some time with Dr. Raj Kakarla. Doctor, good morning.
Good morning.
How are you this morning?
I'm feeling great. How about you?
Well, I have no complaints whatsoever. Tell us a little bit about yourself.
My name is Dr. Raj Kakarla. I'm the Chief of Interventional Radiology over at Mercy Health. I initially did my training, including medical school, undergrad at University of Wisconsin-Madison, and then went over to Chicago for my residency and fellowship, completed my fellowship at Rush Hospital, and then was briefly a teaching attending at Beaumont Hospital in Michigan, teaching medical students, residents, and fellows. And then I came back to private practice in the Chicago area, happened to be doing some locums work, which is kind of like, medical mercenary work over at the old Rockford Memorial Hospital, at which time I enjoyed the staff and the people here in Rockford so much that I made the move to Rockford. And, that began my journey with Mercy. Now I have the, great opportunity to work with a couple of great interventionalists who are my colleagues, and we really built the minimally invasive interventional radiology. Is minimally invasive surgery, department here in Rockford, which I'm very proud of because some of the interventions we do are basically semi-tertiary or university teaching level stuff. That weren't offered here in the past and probably not offered currently still in up to a 60-mile radius. So we're very proud of the work we do here and very happy to help the people in the neighborhood here.
For those not familiar with the lexicon, university-level procedure, what does that mean in reference to our hospitals here in town?
Right. So in terms of minimally invasive treatment, both technology matters a lot and the skill level matters a lot because some of the minimally invasive treatments have only been around, let's say, 10, 20 years. Although they're well known and well trained at university level centers, especially among the metropolitan cities, they may not have translated to smaller suburban communities or rural settings because both the technology is not there, the smaller institution cannot afford them, or they have not had the ability to attract some of the brain drain from the major metropolitan centers where people are skilled to do some of the minimally invasive procedures. For example, what used to involve cutting and, in major surgery and longer recovery time can be done without those, with utilizing CT and X-ray or just doing an angiogram for vascular surgery. So some of that stuff requires special equipment, which the institution will have to acquire and train their staff, not just the doctors, but the ancillary staff, including the nurses and the technologists. So Mercy has helped us invest in that and, basically train some of our younger technologists and helped us do a nationwide search actually for me to find both of my colleagues.
So you guys have brought a world-class procedure to the Rockford area.
That would be correct, yeah. And we're actually currently involved in a multinational study for treatment of pulmonary embolism, which is blood clots that travel to the lungs, and also for DVT, which is blood clots that develop in the veins. So we are among the institutions that were reached out to by this study because we've done so many of them, and actually some over the greater number than some of the institutions in Chicago, including the teaching institutions.
Oh, outstanding. Doctor, you've used the term minimally invasive a couple of times, and I've seen advertisements for different procedures. Minimally invasive. Describe that to us.
Yeah, so what I mean by that is, like, we make Band-Aid size incisions. We don't cut, the patient open. So minimally invasive could be a lot of things. For example, some general surgeons definitely do minimally invasive surgeries. That's called laparoscopic, where they put a scope in through a small hole or an incision, and then use robotic instruments to perform surgery. What interventional radiology does is a little different. We use imaging, whether it is a CT scan or an ultrasound, or for blood vessels, or an angiogram, to basically aid us to get to the area where or the organ that has disease, and able to treat it utilizing catheters, or performing biopsies using ultrasound or CT, or treating abscesses or infections by placing drains in them without having to actually cut anybody.
So it makes it easier on the patient, and recovery time, I'm assuming, speeds up a lot.
Absolutely. So for most of our procedures, the recovery time is basically the same day. For most of our vascular procedures, we send the patients home on the same day within 3-4 hours. For some of the patients that are sicker, have to be inpatient patients. The recovery time from our procedures are usually 1 to 2 days, as opposed to prolonged recovery that would keep the patient bedridden inpatient for weeks at a time.
So let's rewind, 10, 15 years in the area. If somebody was coming to you for a procedure like you're describing right now, what would have happened to them 10, 15 years ago?
10, 15 years ago, they probably would have been sent to either Milwaukee or Chicago or Madison, because at that time was basically when this field was just burgeoning. It was just coming to be accepted, and the skill level of people that were training was getting better and better at that time. So the field has been around, probably since the 60s, I would say. But, in order to get expertise at more and more procedures, and as they were added on, as the technology developed, so 10, 15 years ago, it was probably being done at the major metropolitan centers.
If you're just joining us, this is What's Up, Doc, weekly segment that we do Thursdays here on WROK. Our guest is Dr. Raj Kakarla. He is Chief of Interventional Radiology with Mercy Health. You had mentioned blood clots and DVT, which I'm guessing deep vein thrombosis. Am I right?
That's absolutely correct.
Tell me about those, and what type of patients are more at risk for getting these?
Right. So actually, that's a very good question. So deep vein thrombosis is when people develop blood clots in the legs most often. The blood clots can develop in any vein in the body, including the upper extremity in the arms, but most often people develop them in the legs. Usually, patients that are a little more immobile, let's say, people talk about taking prolonged rides in the car or prolonged air flights. Yeah, that isn't one of the risk factors, but most often people are less mobile than they used to be. Either they're because they're sick, or they're not feeling well, or they're just in bed, or sometimes patients are inpatient. So that's a major risk factor, immobility, because when you're not walking, your calf and your muscles are not pushing on those veins to keep the blood moving along. And so when the blood slows down like that, it tends to clot. The other risk factors are people can have some clotting factor disorders that run in the families. So when people say, yes, I had an aunt or an uncle or mom that, had blood clots, usually their primary care physicians may work them up for, a clotting factor disorder that runs in the families that predisposes them to developing blood clots. The last case scenario could be someone that has a predisposition to developing blood clots because of the medications they may be on. For example, oral contraceptives, that young females may be taking, sometimes predispose them to developing blood clots. Other things are, disease states such as cancer have a higher risk of developing blood clots.
Who Who comes to see you? How does somebody end up in front of you? Are you a first visit, or is it all referenced to you from primary doctors?
Very good question. So, how blood clots were treated for a very long time in medicine, has been giving blood thinners. So they usually go either to their primary care doctor or to the emergency room because they develop swelling in the legs. Now, the blood clot that develops in those deep veins has a high chance, if left untreated, of basically breaking off and going to the lungs. And that's called a pulmonary embolism. So pulmonary embolisms can be dangerous because they place a significant strain on the heart and lungs, and very rarely, if they're large enough, can cause death. So when the patients present early on with blood clots, and it's recognized by doing an ultrasound by either the primary care doctor or the emergency room doctor, they're usually put on blood thinners. Initially, while in the hospital, something called heparin or Lovenox, which is a blood thinner that is given by IV or an injection. Or when they go home, a wide number of therapies. The old therapy was the warfarin, which actually was developed at the University of Wisconsin, or Coumadin, or the newer blood thinning medications, which people know by their brand names such as Xarelto or Eliquis, if you'd see the advertisement for them on television. So that was the way of treating blood clots. However, the way blood clots are treated has changed significantly, and there's a lot of misinformation about that, and even in the medical realm, what people need to be educated on is the fact that not every blood clot is the same. Because blood clots that just develop, let's say, in the calf or just below the level of the thigh, could probably be just treated by this blood thinning medications we're talking about. However, if you have a large area of swelling and it's not getting better, very soon on the blood thinning medication within the week, more than likely the blood clot is, significant enough or extended to the larger veins that these leg veins drain into the pelvis. So those blood clots should actually be, are the ones that present to me, so we can perform, some procedures to get them out. Because the blood thinning medications don't do anything to get those clots out. What they do is reduce your risk of making those clots worse and maybe reduce the risk of those clots breaking off and going to the lungs. However, they don't do anything for that clot that's just staying there. So the patients that come to me have significant amount of clot that is causing a lot of leg swelling. Because what happens is what's called post-thrombotic syndrome, where that swelling gets so bad that you start developing symptoms of venous stasis. Now, that's a kind of a big name. What venous stasis is, basically the blood's not going anywhere, so it's kind of pooling in the leg, and it's causing discoloration and, worst-case scenario, ulcers and wounds in the legs.
Okay, yeah, something to be cognizant of and know that perhaps you need to reach out if you're experiencing any of these things. Doctor,
Correct.
Before we let you go, what is it when you walk away from the job at the end of the day you derive the most satisfaction from?
I actually love everything about my job, and that's kind of why I moved here, because my staff is excellent. They're very keen on learning new procedures. Currently we teach residents and medical students at Mercy, and the first thing I tell them is find a job that doesn't feel like a job, because I love getting up in the morning and coming to work, able to have basically immediate satisfaction, because some of my patients, like, for example, the pulmonary embolism patients, when I'm able to get them off the table and it feels like you saved their lives, those are very few procedures where you can walk away thinking that. As physicians, most of the time, we don't have many procedures that we feel like that. But, I'm happy enough to basically work at a place and do the kind of work I do where I do have that satisfaction.
He's Dr. Raj Kakarla. He is Chief of Interventional Radiology with Mercy Health. Dr. Kakarla, we really appreciate you taking time out of your day. This has been very educational and informative, and, we'd love to have you come back with us again.
Well, thank you very much for having me.